Assalamu alaikum. Hi everyone, I am Dr. Noha Najjar, lecturer of forensic medicine and clinical toxicology. I hope my lecture finds you all safe. المحاضرة النهاردة عن forensic cases. So let's start with how to solve question a case study. What is the secret keys? Number one, you should read all the case scenario and all the question carefully. أقرأ الكيس ستادي كلها والسيناريو كله and all questions اللي عليها الأول. وفي ناس أحيانا بتقولك لا اقرأ الكويستشنز كمان قبل الكيس سيناريو. أوكي؟ المهم إنه وأنت بتقرأ الكيس the first sentence or the first line is very important. اللي هو بيبقى مكتوب فيه male, female, girl, dead, live, الايج بتاعه 18, 30, 40 ايا كان. السنتنس دي مهمة قوي ان انا اخد بالي من التفاصيل اللي فيها. Number 2, highlight every important data that given in the case. اي important informations او important data هو اداها لك اعملها highlighting or underline it. المهم ان هي بالنسبة لي تكون واضحة ومنورة. اوكي؟ So let's start with the first case. Case number 1. A dead girl, 18 years old, was found in a swimming pool. The external examination of the dead body revealed multiple contusions and fingernail abrasions on both sides of larynx, forearms, and inner aspects of both sides. Autopsy examination revealed hemorrhage in the neck muscles, inward fracture of hyoid bone, and tear in hymen. Forensic doctor diagnosed the case as homicidal death after rape with postmortem emerge. Okay? Questions? First question is the victim age can be identified by اللي هو أول جملة اللي أنا قلت لكم عليها. A dead girl 18 years old. Okay? إزاي identify إن هي فعلا 18 years old? Is she a girl or boy? So it is a dead girl, 18 years. You must all know that any female, due to high estrogen level after puberty, she develops early closure or union of epiphysis usually about 2 years earlier. وبالتالي when I talked about 18 years, this means 20 years old. What happened or united at 20 will unite at 18 years old in female. يبقى هدور على الحاجات اللي بتيوناين unite at 20 اللي هي مين بقى؟ اللي أنا هعمل إيه؟ هعمل number 1 X-ray or dissection on the wrist to ensure the union and union of epiphysis of lower ends of ulna and radius, and on shoulder for union of epiphysis of head of humerus لأن هما دول اللي بيقفلوا عند 20 years old. ده the first part of the question. Second part, its medical legal importance in Egypt. Medical legal importance of age 18 years. In Egypt there are many medical legal importance, like age of female consent in rape, age of voting in elections, age of getting driving license, age of full criminal responsibility. اختار 3 واكتبهم. Okay? Second question, the cause of death in this case is, what do you think? Of course, it is manual strangulation or throttling. Okay, this cause can be proved by what? هو عايز two causes أو two clues أنت استخدمتهم عشان توصل للcause of death ده اللي أنا قلت عليه إن هو manual strangulation or throttling. هقول إن external examination there are general evidence of violence on the body plus examination of the neck there is multiple contusion and fingernail abrasions on both sides of larynx, and internally لقينا فيها ايه hemorrhage in neck muscles and inward fracture of hyoid bone. اوكي؟ لما ارجع الكيس هلاقي الكلام ده مكتوب. Number 3 medical legal importance of hyoid bone. What's the medical legal importance of hyoid bone? Okay, first estimation or identification of age, as at age of 40 years there will be ossification and union of the joints of hyoid bone. يبقى أول حاجة إن أنا estimation إن أنا أقول إن ده at age of 40 above or below according حصل ossification or union of the joints of hyoid bone or not. Number 2 for diagnosis and differentiation of manual and ligatoral strangulation and hanging. As you all know, manual and ligatoral strangulation, the hyoid bone undergoes inward fracture, while in hanging it will undergo outward fracture. Fourth question, mention the evidence of recent ruptured hymen and types of hymen. Mention. What is the evidence of ruptured hymen, recent ruptured hymen? Of course, presence of tear or tears at the hymen, which is associated with bleeding, redness, and edema. طب, what is the types of hymens just mentioned? أقول number 1, semilunar or crescentic, which has opening, crescentic opening. Number 2, annular, which has central opening. Number 3, dental. And 4, fimbriate. 5, cribriform, multiple small opening. 6, septate, which may be السبتم ده horizontal or vertical. Number 7, imperforate hymen. Just mention. 5, explain the medico-legal importance of the size and extent of fingernail abrasions on both sides of victim's neck. The size and extent of fingernail abrasions. We can know whether the assailant is left or right-handed, or used both hands, or have amazed fingers. يبقى دي medical legal importance بتاعت الاكستنشن والسايز بتاعت الفينجرنيل abrasions on the neck. Number 6. Explain exclusion of true drowning as a cause of death in this case. ليه أنا ما قلتش عليها دي true drowning؟ Of course, due to absence of usual signs of wet or true drowning, which is there is no foam at the mouth and nostrils بالcharacters بتاعته اللي هي white mushroom like mass, odorless, fine, persistent foam, plus absence of cadaveric spasm of hands in the form of something like the hand firmly grasp anything related to the water like sand, mud, weeds. مفيش أي حاجة من الحاجات دي. بس كده لأ، كمان absence or only presence of small amount of water in the lung or in the air passages. يا مفيش خالص يا إما very small amount في air passages and في lung, plus no evidence of water in the stomach. Okay, this is the last questions of case number 1. Let's go to case number 2. A young male, 30 years old, was found dead in his room. On examination, the medical legal expert reported that the intraocular pressure was 0. There were patches of hypostasis on the back. The multiple cut wounds on the palm and forearm were detected with stab wound on the left side of chest. The rigor mortis was completed. Okay? In this case, the manner of death is what and why? What do you think? Of course, it is homicidal. Why? Due to presence of defense wounds اللي هي عبارة عن multiple cut wounds on the palm and forearm, plus stab wound on the left of the chest. As you all know, most stab wounds are homicidal. Okay, yep. Due to presence of defense wounds and the stab wounds. Number 2, the time passed since death. Can you figure out it? Yes, about 2 years, 2 hours, sorry, about 2 hours. Why? Depending on 2 factors. Factor الأولاني إن intraocular pressure equals 0. As you all know, during life, the intraocular pressure equals from 14 to 25 gram. At death, it dropped to 12 gram. After half an hour, become 3 gram. At the end of 2 hours, become nil or 0. So here is 0. Factor number 2, the hypostasis. We will find the hypostasis in the form of small or patches, still patches. As you all know, the hypostasis develops as small patches within half an hour, and from 2 to 4 hours, the small patches enlarge and united to merge together to form extensive hypostasis. Here, the hypostasis still patches plus the intraocular pressure 0. This means it equals about 2 hours. Question number 3. What is the mechanism of death? case of stab wound, sure, hemorrhage and hypovolemic shock. Question number 4. Comment on these different types of wounds. What is the different types of wounds here in this case? We'll find 2 types. The first, stab wound on the left side of the chest, في stab wound. Number 2, the multiple cut wounds on the palm and the forearm. When we give a comment on stab wound, we should mention its الايدجز بتاعتها الكاركترز بتاعتها ان هي regular with clean, with no bridging or abrasions, absence of bridging tissues across the edges, the depth is greater than the length, bleeding here is free, more liable for infection, and it is more dangerous than other types of wounds like cut and lacerated wound, heals slowly, leaving thin linear scar. And what's very important in stab wounds that it has a relation with the causative agent, like in the length of the wound equals usually the width of the blade, unless ان السيلانت move the blade forward and backward وابتدى يحركها. here we'll find the length of the wound may be greater than the width. Also the depth of the wound usually equals to the length of the blade, unless ان هو يكون البليد ما دخلتش كلها او دخلت بزياده. also the width of the wound equals the thickness of the blade. And when we look at the shape of the stab wound and its angles, if we find 2 angles, this means the blade is double bladed, and if it is only one angle, has only one angle or triangular in shape, this means that the blade used or the instrument one bladed. Okay. Then these multiple cut wounds on the palm of forearms, these are defense wounds, which is characteristic injuries in assault victims, which indicates that the victims attempt to defend themselves. There are many types, but in this case the instrument was sharp instrument, so we will find the cut wounds on different places, like palmar surface of the hand, back of forearm and upper arm, sometimes across the flexor surface of finger joints, or between index and thumb. Okay, let's go to case number 3. Male, aged 18 years, was admitted to the hospital by his father, who said that his son lost his consciousness for minutes after a car hit him during crossing the street. On admission, the patient was drowsy with a wound in his scalp. The wound was sutured and the patient was discharged after 3 hours. 24 hours later, he was comatose with signs of lateralization. Okay, the questions. First question: how to prove the age of 18 years? هرجع تاني, male or female? Male, so 18 equal 18. So I will do x-ray, مش هقول dissection لأن ده واحد عايش, by x-ray on a hip joint to ensure the union of epiphysis of the head of the femur. Number 2, on ankle to ensure the union of epiphysis of the lower ends of tibia and fibula. Number 3, on hands and feet for the union of heads of the metacarpal and metatarsal bones and the proximal ends of phalanges of fingers and toes. Okay. Second part of the question, and list is the medical legal importance of this age. As I mentioned a little bit before, لسه احنا قايلينهم من شوية. In this case, السؤال التاني, discharging of the patient after 3 hours was a fatal mistake. Explain this statement. اوكي, نرجع تاني للكيس. هلاقي ان في الكيس سيناريو ان هو قال the patient lost his consciousness for a minute, which means ان هو حصل له concussion, as concussion is the transient loss of consciousness following a head injury. And what is the treatment of concussion? The treatment is conservative with hospitalization for 48 hours, not only 3 hours زي ما حصل معاه. During this period, the patient is monitored for his vital signs, pulse, blood pressure, respiratory rate, temperature, and for the pupil sizes, the muscle tone and the reflexes, for early detection of any signs of brain compression. لكن هنا حصل ايه؟ Discharging this patient after 3 hours made the doctor who discharged this patient and don't hospitalize him under the legal action of negligence. as the patient was in lucid interval. هو كان في lucid interval اللي هي between concussion and compression. Okay. Number 3, mention the mechanisms and signs of lateralization. Mechanism, as you all know, when hematoma formed, it will first compress the vessels اللي ليها thin wall اللي هي veins, thin walled vessels اللي هي veins, so leads to a state of congestion, which means which leads to irritation of the brain. دي اللي أنا بسميها irritative stage. Then the hematoma increase in size and will compress the thick walled arteries. This leads to ischemia or cause paralytic stage. الميكانيزم ده هو المسؤول عن المانيفستيشنز or عن signs of lateralization اللي دايما بلاقيها in eye and limbs. When we examine the eye, we will find conjugate deviation of both eyes towards the side of the lesion. العين باصة الاتنين في اتجاه الليجن. Plus, we will find unequal pupils. We will find the pupil on the affected side is constricted first in the irritative stage, okay, due to congestion, while the pupil on the contralateral side is normal, still normal. Later on, the size, the pupil on the affected side will dilate لما تبتدي تدخل في paralytic stage due to compression of the arteries, while that of the contralateral side become constricted. And finally, both will dilate. This is certainly because the pupil is supplied by oculomotor nerve of the same side and by some fibers from the opposite side. When we go to the limbs, we'll find exaggerated reflexes on the contralateral side in the irritative stage, followed by muscle paralysis in the paralytic stage. That is because the limbs are supplied by motor and sensory nerves from the opposite side. Okay, let's go to the case number 4. A newly born full-term infant was found lying dead in the small farm, and the umbilical cord was twisted around the neck. Okay? Questions. How can you prove that the infant is full-term? Of course, we will find that head circumference is 13 inch. We'll find the posterior fontanelle closed while the anterior fontanelle is still. Weight will be about 3.5 kilograms. The length will be about 45 centimeters. Placenta, if we find it, will be 600 grams. Skin bright. If this baby or infant is male, then the testicles will be in the scrotum. When we do dissection, there will be well-formed ossific centers in calcaneus, talus, cuboid, upper end of tibia, and the lower end of femur. Its ossific center will reach half centimeter in diameter. Okay. Second question, how to differentiate between accidental strangulation by coiling the cord around the neck during delivery and criminal strangulation. I know that some of you will answer إجابة مختصرة اللي هي إن homicidal strangulation or criminal strangulation, the cord is longer than normal and it may be lacerated and the Wharton's jelly is displaced. But to answer this question perfectly وتجاوب إجابة صح, we should differentiate between the homicidal or criminal accidental strangulation from the all views. بمعنى إن أنا هبتدي أقول externally من أول الرابنجز. في الكريمنال ممكن ألاقي presence of well-formed yellow stool or digested milk due to vomiting, while accidental ده still purse. يبقى no, مش هلاقي حاجة من الكلام ده. السكين في الكريمنال ممكن ألاقي presence of desquamation, accidental maybe maceration. الumbilical cord here في الكريمنال ممكن الاقي بقى longer than normal, هحطها هنا بقى ولacerated Wharton jelly displaced, لكن في الاكسيدنتال هلاقي normal length وهلاقي الوارسون jelly well distributed. اجي ابص للستامب when we examine umbilical stump ممكن الاقي reactive changes هنا في الكريمنال لكن no in accidental strangulation, وmaybe الاقي umbilical cord intact, untied or attached to the placenta. Examine the whole body for antemortem injuries may be found in criminal لكن not in accidental strangulation. اوكي. بعد كده هبتدي ابص على internal examination on بدور على evidence of respired lungs, وابتدي كمان اشوف الجي اي تي والكارديوفاسكولار. for respired lung Macroscopically, if this case is homicidal or criminal يبقى حصل أكيد respiration. Okay, so هلاقي evidence of respired lung بمعنى ان انا هلاقيها large fills the chest cavity covering the heart and thymus, rounded edges, mottling appearance, spongy inconsistency. While in accidental, no, I will find the lung small, don't fill the chest cavity, don't cover the thymus and the heart, uniform purple in color, sharp edges, firm في الconsistency اللي بسميها liver like. When I examine it under the microscope, here في homicidal it will be distended alveoli with flattened epithelium, while accidental it will be collapsed alveoli lined with columnar epithelium. When we do static test, the lung, respired lung will be 80 gram, 1/35 is the body weight, while in accidental the non-respired lung will be 40 gram or 1/70 of the body weight. When I do hydrostatic flotation test, lungs float in water and even the small pieces will float even with pressure لو كانت هي respired. If non-respired lungs, so it will sink and the small pieces also sink. Okay? GIT ببتدي أدور برضو على air في السtomach. If I find air في السtomach or the intestine, this means it is homicidal. طبعا ما فيش في الaccidental. Search for saliva in the stomach or food like colostrum in the stomach, presence of well-formed yellow stool in the intestine. ده معناه طبعا ان هو كان عايش وان هو ده كان homicidal ويمكن كمان ان الايدج بتاعه over 6 hours. Okay? When we examine the cardiovascular umbilical vessels هلاقي فيه reactive changes في الهوميسايدال or criminal لكن no in accidental. The ductus arteriosus may be closed or it will be closed in the homicidal لكن it will be not closed in accidental. foramen ovale may be closed لأن هي طبعا احنا عارفين إن هي بتقفل عند 1 week لكن it's still open in الaccidental. كده أكون أنا عرفت أفرق كويس أعمل differentiation وإجابتي تكون مظبوطة و ideal. Let's go to case number 5. A 40-year-old female was found dead in her house. The crime scene was disarranged with pooling of blood beneath the cadaver. At autopsy, the following were detected: generalized muscle stiffness of the whole body, faint extensive fixed hypostasis at the back of the cadaver, multiple cut wounds at the palmar surface of hands and back of forearms, transverse deep cut wound of the neck passed through the larynx with multiple cuts. Question number 1. What is the time of death and why? Okay, the time of death will be from 6 to 12 hours, depending on 2 factors: presence of generalized muscle stiffening of the whole body, and number 2, this fixed extensive hypostasis, and it is faint, of course, due to pooling of the blood. Okay. Question number 2. What is the medical legal importance of pooling of the blood? This means presence of victim for a long period of time in that place, and also means that that is the exact scene of the crime. Question number 3. What is the proximate cause, mechanism, and manner of death? What do you think? What is the cause of death here? Of course, this will be cut throat. What is the mechanism? Number 1, fatal bleeding due to cutting of the jugular and carotid arteries. Obstruction of the air passages. This is number 2, obstruction of the air passages due to cut of the trachea and entering of blood into the airway. Number 3, air embolism. What is the manner? It's homicidal. Why? When we look at the scene of the crime, it was disarranged. External examination of the body, presence of defense wounds اللي هي multiple cut wounds at the palmar surface of hands and back of forearm. This means a sign of struggle and resistance. And when we examine the wound, examination of the wound revealed transverse deep cut that pass through the larynx with multiple side cuts due to movement of the victim. Okay, وبكده بكون طلعنا المعنى. By the end of this question, the lecture is ended. I tried to conclude and revise with you a lot of topics. So finally, you have a beautiful mind. Always use it. Stay safe and goodbye.